Welcome back to the show, Talk with your doc. And with me is Dr. Walid Shahrour. He is a urologist at Thunder Bay Regional Health Science Center, and we are talking about prostate cancer. We talked about various causes and the risk factors for the prostate cancer. Are there any lifestyle modifying factors or any medications which we can use it to reduce the risk of prostate cancer?
We always think that having a healthy lifestyle is always important. Patients who are, for example, obese, we think that they have higher chance of having prostate cancer. But we always think that, okay, you know what, if you go for a healthy diet, healthy exercise, this can actually might decrease the chances. Some people say, you know what, maybe because you're a health oriented person, you're maybe you're checking your health better,
Right.
and that's why you're probably you're checking and maybe you're having less incidence, or maybe you're preventing it somehow from the exercise. But there's some evidence, but it's not as strong as we would want.
How about any medications or any drugs which are available in the market which can reduce the incidence of or risk of prostate cancer? Are there any?
So there used to be the idea before that taking vitamin like vitamin E or selenium, like that this would decrease the risk of prostate cancer. As I said, like before as well, with this, it's not a very strong evidence.
Right.
If you want to take it, it doesn't hurt, but it is not the sole preventive method. Some people thought of of aspirin.
Right.
It has been shown in some research that there's decreased incidence, but still there is no science behind it as much as we would want.
How about 5-alpha reductase inhibitor drugs which are available in the market? Do you think those reduce the incidence of prostate cancer?
That's a very good question. So 5-alpha reductase basically is a medication that blocks the conversion of testosterone in the prostate. So it's actually a medication that we give for patients who have benign prostatic hyperplasia or an enlarged prostate. It shrinks the prostate.
Right.
It takes few months to start having an action. And people were thinking, okay, if it's actually shrinking the prostate, maybe it could have an effect on the cancer.
Right.
So there were studies, and big studies actually, very large studies done, and they were looking at what if we give this family of medication to the patients and see how they do. After some time, then they were basically checking, doing biopsies, and they found that there is an absolute reduction in the incidence of prostate cancer when you give this medication.
Okay.
Then they did further studies in the same research that they were doing. They found that there was increased incidence of higher grade prostate cancer on patients who are taking this medication.
Okay.
So then it became basically a dilemma, and the people were like, okay, so now we should not give it because it's giving a higher chance of higher grade cancer.
Right.
Then further analysis has been done. People are saying, you know what, maybe it's because we're shrinking the prostate. Then when we are doing biopsies for these patients, we're catching more disease because now it's easier to catch the cancer because now the concentration is basically more evident because now the prostate is smaller.
Right.
So it has some preventive methods, but it is not really
so
a way
it is not routinely used in practice.
It is not used. Like I would not give it to my patient and say, okay, you know what, I'm giving you this medication to prevent cancer for you.
Okay, so that's not used, right. So how a patient with a prostate cancer present, what are the signs and symptoms of prostate cancer? If one has a prostate cancer or not, how can we come to know?
That's a hard question because you know what? It's a silent killer.
Okay.
We can't tell. I tell the patient, you know what? We can't, like signs and symptoms, you might have no sign or symptom until later on. Sometimes they present to me with with some symptoms of problems with urination, hard time initiating urine, intermittency, incomplete emptying of their bladder, weak stream, but these are also symptoms of benign prostatic hyperplasia.
Right, so it's confusing.
It's confusing. So usually to diagnose it, it basically comes from rectal exam and doing a blood test.
Investigations,
exactly.
Right? So, a lot of people do the PSA blood test, prostate specific antigen test, and there are set levels. We as a pathologist, we issue quite a few report of prostate specific antigen report. So, can you please tell us correlation between the level of PSA, what is PSA, and how one can get that test done?
So to understand PSA first, we need to understand what it is. It's a protein produced by the prostate.
Right.
So I have a PSA, you have a PSA, anyone who has a prostate usually
Everybody has a PSA
exactly.
in their blood.
And it can go up and down because of anything.
Right.
It's not very specific to cancer.
Right.
It can go up because of infection,
Yes.
instrumentation. You have had you have a large prostate in general.
Right.
So whenever we talk about prostate cancer and PSA, we have to identify the acceptable level
Right.
and to correlate it with other parameters.
So what is the cutoff level?
We always say it's 4,
4 nanograms.
and
Yeah.
now people are going more towards 3.
3. Oh, it's even
It's
lower.
even getting lower now,
Right.
because like depending on age. So there is 4 is not just a number,
Yeah.
because if you are 70 and your PSA is 4, most likely it's a very good PSA,
Okay.
because also we have to correlate it with age and
Age.
prostate size.
Right. So 4 to 10, they say increased risk, and more than 10, they say it's more than 50% of patients with 10 or more PSA will have cancer. So what next then? Once the PSA is higher, then what do you advise to the patients?
So PSA, we don't take it only in one shot, like we don't take it just one number, we have to
Okay.
see a pattern.
Okay.
So because sometimes maybe this time it's 10, next time it's 5, because it was not there was some inflammation happening, there's something happening in his body, in the patient's body,
Right.
that caused the PSA to go high. So we have
Right.
to get a pattern.
Okay.
And once we see the pattern, there are also other parameters. We see the free amount of PSA to the total amount of PSA, and we see there is a ratio. Sometimes if this ratio is too high, then we think it's okay. If it's too low, maybe it's actually having a higher indication of cancer.
Right.
So we also divide PSA less than 10, it's lower risk. Above, between 10 and 20, it's intermediate risk. Above 20 is higher risk
Right.
of prostate cancer.
So once you have a PSA high level and the pattern is high, then you might do prostate needle biopsies, and you send it to us as a pathologist, and we report the prostate needle biopsies by taking how many cores are there, what is the percentage of cancer in prostate needle biopsies, and what is the grade of Gleason scoring of the prostate cancer. And it is said that higher is the Gleason score, worst is the prognosis, or aggressive is the prostate cancer. So what do you do when you find higher Gleason score? What next investigation do you do after the prostate needle biopsy is done?
It all depends. Basically, if the patient depends on my rectal exam and the PSA. So if I have a patient who I'm like having a very high PSA, let's say PSA comes back at 50, I probably would want to check if there is any disease outside.
Right.
So sometimes we ask for a CT scan to
CT
check
scan.
if there is any cancer outside, or we also get a bone scan
Right.
to check if the prostate cancer has gone into the bones, because this is a
Right.
very high level.
Right.
It's always a multidisciplinary approach
Right.
between the urologist, the pathologist, the oncologist,
Right.
radiation oncologist. So
Right.
it's a whole team that decides together
Right.
what's going to be the best next step.
So first is digital rectal examination, then is the PSA, then you might do the biopsy, and if that is positive, you do the radiological investigation to see the extent, and then the treatment.
Exactly, if needed.
Needed.
That's exactly
Right.
it.
So thank you for that. We'll take a short pause, and we'll come back with the next part of prostate cancer. We'll talk about the treatments in prostate cancer. Thank you, Dr. Shahrour.
Thank you.